Dr. Lindsey here. People sometimes come in and ask, how come, doctor, you can't cover my entire head? And the answer turns out to be a combination of hair supply, hair need, and strip physics. So when people are thinning from the front to the back and they have very thick coarse hair and it's quite dense in the back, yes, you can usually cover the entire head. If they have very limited and sparse fine hair, there's no way you can cover the whole head. And you really have to have enough density in the front to make it worth doing and accept a balding crown. Now, as far as strip physics go, we run our strip from just above each ear and across. There's a small bony protuberance in the back of your head. And my strips tend to be about 1.7 centimeters wide because I know that over the course of 20 years I can close those strip excision sites in 2 or 3 layers and almost always get a pretty good scar. Sometimes there's people that we can close much easier, and I wonder if we couldn't go a little wider, but you never can tell how a scalp's going to close until you start closing it. It's kind of like Forrest Gump's life's like a box of chocolates. You don't know what a scalp's going to have until you try to close it. So to be on the safe side and get pretty consistently good scars, my strips are 1.7 centimeters wide, and the only thing that changes is the length. A larger case we go with a longer strip. Now some folks take the strip and bring it up in front of the ear, even up to the temple. And the problem with that is that this hair is more unpredictable as far as going away. So you do this as a youth and that hair thins out and goes away and the scar becomes visible. And at least in the Washington, D.C. area, we work on so many guys that have to have a short haircut that there's much less safety margin with hair coming down and covering even a good scar in that area. So again, my scars typically are ear to ear or shorter and 1.7 centimeters in width. So I'm going to show a few cases. The first illustrates a 55-year-old guy with class 5 hair loss and our approach to deal with the front third of his head. The second will show why we don't sprinkle a little bit of hair all over the head in the hopes of kind of covering everything. And the third will show a person with significant hair loss in 2 cases with a short haircut. I hope you find this interesting and useful. Okay, so this is case 1. This is a 55 or so year old man with fairly dense hair, but he's class 5 with the last remnants of a little crossbar going across his head. So we decided to give him an age-appropriate hairstyle and put a few protuberances out in front so that it looks natural once it's grown in. And again, between the first 2 lines we put very dense packed single hair grafts. Back here we put grafts that have 2 hairs in them, and back here 3 hair grafts. So this is after the creation of about 3,000 slits. The front of the head's up here, and the crown is back at this end. This is at the end of the day, and this left this man with a really nice, densely packed hairline that does not look like a hair transplant. It frames the entire frontal third of his face. And we'd considered doing a second case on him. He can style this hair however he would like to. A second case would have almost certainly completed his middle third and crown. But at age 55, he felt this was sufficient to achieve his goals. And I don't disagree with that. And his scar is relatively difficult to find, certainly smaller than the width of the blades of the comb. And in this case, I'd like to show why we don't sprinkle hair around a large balding area in the hopes of solving a patient's problems. We see several of these per year. This young man had supposedly 2,500 or more grafts placed at a different surgery facility, and was told that this would fix his hair loss. This is now 2 years out. I think what has happened is he's continued to lose his own hair. He'll eventually lose this crossbar, and he'll be very similar to the patient that I just showed. When we shaved him down to do the repair case, you can see that there's a graft here, and here and here. It's just not enough hair. You have to pack the hair tight in order to get good cosmetic coverage. And this is our slit placement, and it's really quite dense. But you need this density in order to get a result like this at 10 months. And that just requires a lot of hair, packed tightly as you can get. So I hope this clarifies why we don't sprinkle a little hair all over. I certainly prefer to address one area and put it to bed and then come back and deal with another area. And I'm only constrained by the density of the donor hair as to the size of the case. Now this becomes a much more challenging case. This is really the trifecta of large bald scalp, extremely fine hair, and the requirement for a short, close-cropped hairstyle. And particularly on the sides, he would require a very good scar. We stopped the strip here, although we could get more hair by extending up this way. There's just simply no safety buffer to cover anything other than the perfect scar. And since I can't always predict that we'll get a perfect scar, in most of these short-haired guys, we really need to stop just above the ear. And this is him from behind. Again, he's a class 6 or more hair loss with very fine hair and a large goal to try to achieve. So we created an age-appropriate hairstyle, again with a few protuberances out in front. Here's roughly 2,800 slits. And the grafts placed. This is at a week. His short hair certainly covers where his sutures were, and when the sutures are removed, even short hair covers the scar line quite well. So we got him to here. This is at 1 year out from surgery. Now, I think that his left part line is still a little on the thin side, primarily because of his fine hairs and significant color mismatch between his scalp and his hair. So at the second case, we'll put a few hundred singles along that left part line and put the remaining grafts behind where we worked before. And this is him from above at a year, looking quite good with the limitation of fine hair and a color mismatch. This is the surgical, these are the slits that's created for the second case. At the top of the screen is his first hair transplant, and we're working back towards the crown. And we ultimately got him to this, which is a big change from not having any hair to begin with. And that hairline does not look like a hair transplant. It's irregular and consists of single hair grafts placed at the edge in an irregularized fashion. And from behind, he still has a bald spot, but we've given him coverage from the front to the crown, and his scar line is very difficult to find even with that short hair. So I hope this has helped clarify my philosophy on how much scalp we can cover at one time, and the strategy of covering guys' scalps with significant hair loss. Our goals are to get a natural result and limit the amount of scarring that a person has so that they can have the hairstyle they desire. Thank you.